After your neck operation, we'll discuss various discharge instructions. I'll go over them that night and probably the next morning and reinforce it. I'm sure the nurses will also, and we'll actually send you home with literature about this. However, we'll discuss wound care, follow-up, medications, and activity restrictions. Your wound care is fairly simple. It'll be covered with a small piece of gauze and a clear plastic dressing. So long as that stays dry, you can take a shower. If you think it gets wet after a shower, I want you to take the dressing off, blot it dry, blow dry it dry, and you don't need another dressing at that point. If at any time you think that there might be an infection, for example, an advancing red zone, any pus, gets hot, if you're worried, I'm worried, you give me a phone call and I'll take care of it. The next aspect is activity restriction. This is a lot harder to explain, but to summarize, if you can imagine falling and hitting your head, you don't get to do that. So no skateboards, no bicycle riding, no motorcycles, no ATVs, no ladders, no roofs. You can go up and down stairs. Be careful, hold the banister. You can take a shower, but when you get out, be careful not to slip and fall. Lifting is not so much how much, but how. So lifting near here, near your body, is fine. Lifting over your head can be done, but be careful with it. And you'll find that your neck gets stiff a lot easier than usual. So when your head is down or when your head is up, just remind yourself to move it around a little bit. As far as your medications are concerned, you'll go home on anti-inflammatory medicines, which you'll generally take for a few months, a muscle relaxant, which is helpful for about 4 or 5 days or so, and then finally a narcotic. I will choose your medications based upon your allergies and what I think would be best for you. You will notice that I will constantly be encouraging you to get off of narcotics, partly because of the side effects of the narcotics, but also because you generally don't need them. I can tell you from my own personal experience from my neck surgery, it doesn't hurt very much, and if you don't need the narcotics, we don't want you taking them. Lastly, we'll set up your follow-up appointment with my office while you're still in the hospital. Normally, I will want to see you back in about 1 month, and generally another 2 months after that, and we'll get x-rays to make sure everything looks good. Obviously, during that time, at any time, if you're worried about what's going on, you need to call me and we'll figure it out.